Okay, I'm starting recording now. So let's have a look at it. We'll do Mr Seymour. I think there's just a couple. What I'm trying to do is to get people who haven't been assessed so far. This is what I'm trying to do. I'm trying to, get people who haven't been assessed so far, because I notice some people keep sending letters every day, and people who haven't been assessed are not. So anyway, so what I'm going to do, I'm going to save the changes on both of these files, and I'll put the files in Easy Class. Okay, so let's have a look. So first thing, go to the task. What's it tell us? Information for right now. Somebody in the channel was asking something yesterday, I think, about the difference between referral letters or discharge letters or update letters, and I said then, and I'll say it now, depends on the wording of the task. Depends on the wording of the task. Someone was asking yesterday, I can't remember who it was, about these very general and common expressions that he, well, and I see in these letters of the, your urgent assessment and management will be highly appreciated, or whatever. The same cliches, the same memorized phrases in every letter. They're no good. They might be okay for a low B, 350, but if you want a decent score, to be the best that you can, because it's an English test, and if the examiner sees the same cliche phrases, he's going to think, well, that's not communication, it is memorization, which is not the same. Somebody also said something in the group this morning about benchmark service, and he shared a couple of letters from Benchmark. Well, I took a look at them, and there was nothing there. There was like half a sentence of comments and a couple of corrections, and they'd missed a lot of grammar. They had missed quite a few things, and they gave it like a B or something, or an A, I don't know, but they'd missed a load of grammar, and they didn't give them virtually any comments. They just give the same advice all the time. Proofread before submission, or watch it. I thought, well, that is crap, and people are paying money for such a service, and it's not very good. So I wouldn't rely on Benchmark. I've seen some examples in the past, and those two examples that we saw this morning were not so good. As a matter of fact, let's just have a look. I'm just going to show you this now. Hang on. Let me go to the group, and I'll show you. I don't know if I downloaded them or not. I might have. Did I download them? Yes, I did. Hang on. Right, can you see this? Can you see this photograph? Yeah, this is one of the benchmark that someone shared. Right, comments. This is a well-written letter. Hey, what does that mean? Signs and advice. Highly, you see, the same thing would be highly appreciated. She's a chronic drinker, depression. Kindly note. Why would you kindly note? Why would you note in a kindly manner? And how can you kindly note? Can you tell me? I mean, note's a verb, but how can you kindly? How can you kindly note? Hang on. What's this? Yeah. Somebody put some things here. However, she does not smoke. She's a chronic a drinker. So you've got Mrs Johnson, 76-year-old retired teacher, and we can work this out, right, from the date of birth, and we don't need to know that she's a teacher. Would be highly appreciated. Why would it be highly appreciated? Is he doing you a personal favor? Well, no. So, however, she does not smoke. Now, right. However, why? So, I mean, they have changed this, right? So you've got Mrs. Johnson is divorced and she lives alone, and she doesn't smoke. So if she doesn't smoke, why mention it? If she doesn't do it, why say that she doesn't do it? I'm sure there's lots of things that she doesn't do. Do we need to say all those things? She's a drinky, sorry, kind of note. Well, oh, okay. With a history of muscle pain, right? So we don't need that. Therefore, she was commenced on a. So we don't need this indefinite article here. On review after a week or 1 week later, the pain was persistent. Now, and she had lost 6 kilograms of weight in the last 2 months. So what's that got to do with, so where's the consistency, a logic? So, okay, she's got a history of pain, and she's also lost some weight. And then on the review later, she's still got pain. So you've got in the past, a week later, 2 months ago. How is that logical in terms of a chronology, right? And we don't say, okay, Mrs. Johnson's pain, you don't need that period, was deteriorated. How can your pain, why is that passive? That is nonsense. The skeletal range of females both from your analysis probably might have been above, greatly appreciated, twice in a week and kind of. So there's mistakes here that they haven't even seen or they've not commented on. And they've just put, oh, this is a well-written letter. So, benchmark. What a load of rubbish. Let's see what else we've got just to show you this, and then we'll get on to yours, because I'm sure that's what we want to see. So let's have a look at this next one. I'll do a share again. I don't know, is it this letter? No, I've just done that one. Yeah. Let me share the right letter. Okay. So, okay, apart from a few inaccuracies, the letter is well written and covers all the case. Okay, well, and the advice, it's always exactly the same. Revise grammar, really. Be careful with spelling. Oh, you think I should? Always proofread. It's the same. Your assessment and management, highly appreciated. She's got 2 kids. Okay, kindly notes. Why? People are using the same expressions, the same phrases, in light of the above, blah blah blah, and they change 1 or 2 things. Mrs. Hilton's condition was improved or has improved with decreased where she had given consent. So, I'm not convinced. I don't think that wasting your money on benchmark is a good idea. Anyway, so as I was saying before, to get to the task, right? So we want the rheumatologist to, so we are asking, we're making a request to this person to give further treatment or investigations to our patient. Okay, so what's the treatment? Refer to on patient's insistence. Right. So we have to mention that. We have to send a copy of pathology. You have to mention the patient specifically insists on seeing this person. And then we've got social history. Okay, we might not need that. Maybe, well, this, etc. Okay, anyway, so let's get on with this. Dr. Ahmed. Now, I don't know if she's here. Dr. Ahmed, are you here? Maybe not. Is she here? No? Doesn't look like it. Well, maybe she'll see the video later. Okay, now, this is good. I'm writing to request your further investigations, right? So instead of saying, I'm writing to refer your assessment measure, highly appreciated, blah, 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 we've got something that is better, direct and to the point. I'm writing to request your further investigation, possible test management of Mr. Seymour. I would just put, I mean, in the case notes, it doesn't, does it specifically say about the sample or anything else? Does it really say that? Yeah. It's okay, so you could include it. I would be tempted to put, you know, why do people keep on breaking it up? Investigations and management of Mr. Seymour. So you've got investigations, including the purpose and management. Why not put those together and then say that? But anyway, that aside, that isn't bad. Okay, there's nothing wrong there. In terms of past medical and social history, or in terms of his past medical social history, is heavy drinker and has been, that's good. Present perfect continuous. Recurrent episodes of gout since, good. Now that's very good use. You see, you've got present perfect continuous with the adverb since. Very good. There's a family history of rheumatoid arthritis in the case. That is pretty good. So far, don't have to make any changes here. Mr. Seymour presented with a history of, I don't know if gouty is a word, if we can use that as an adjective of an adverb, of gout attacks, disciplining nights, he was non-compliant. Now, non-compliant, again, we've seen this before. Recommendation not to use it. Non-adherent is what we're supposed to say these days. But still, non-compliant with current medicines for gout and examination, perfect too. Now, right. Well, what's wrong with this? What's wrong with this structure? Isn't it? Now, right, I know that people, you know, passive is more formal. Okay, it is meant to be a formal a letter, but some constructions, some sentences don't really work in passive, you know. So on examination, the red painful first left toe, which was moderately inflamed, was noticed. That doesn't work at all. That just sounds really long and complicated. On examination, I noticed red painful first left toe, or on examination, his left toe seemed to be inflamed or something such as that. But this sentence here, it's a little bit long to make it passive. I mean, the whole point of passive is it's supposed to make sentences shorter and concise. It's not supposed to make them longer. So I think active voice might be better here. However, the evidence of a joints was involved. Now, what does this mean? No evidence of other joints was involved on this patient. That, sorry to say, doc, but that is nonsense. Don't know. I mean, I think what you're trying to say is that you didn't see evidence of anything wrong in any of his other joints. But the way that clause is phrased is nonsense. It doesn't mean what you think it does. So that's not so good. This sentence here needs a bit of attention. Okay. Subsequently, in addition, compliance with his previous medication. You see, overuse of passive You're making nonsense sentences. They're too long, too complicated. So subsequently, after this, in addition to, I recommended he comply with his previous medications. Well, you could have made that sentence easier, shorter, and easier. Furthermore, I made a discussion. Well, you don't make a discussion. You can have a discussion for sure, but you can't make. Furthermore, I had a discussion with this patient, with him, to modify. So, right, you have a discussion about, so this is a bit complicated too. So, furthermore, we discussed how to modify his lifestyle, etc. So as it, yeah, right. So anyway, I would change that sentence too. That's a little bit complicated too. Please note, Mr. Seymour believed he had rheumatism, therefore he requested to be referred to a rheumatologist. On review today, Mr. Seymour's condition has improved. An X-ray has shown mild due to change of joints. Constantly was discussed with the patient. Again, wise overuse of passive. Again, was discussed with the patient in the next episode of gout. Does this mean that you talked about the next time they have gout, they might need to have a sample test? Because the way that's written there, too complicated. In view of the above, my provisional diagnosis is gout. Refer this patient to. Okay. So this is not bad. We've got 3 sentences here that's a little bit overly complicated, shall we say? They could do with a bit of attention. Okay. Now, I don't know if you can hear this in the background. They're renovating the office next door, making a bit of a nuisance of themselves. I don't know if you can hear that banging. It comes occasionally. They're tearing out the walls. Well, it's a bit annoying, but we'll carry on. So, Dr. Rahman. Is Dr. Rahman here? Dr. Rahman. Are you here? No? Are you here? No? Okay. Dr. Still, Mr. Seymour. Well, it's not spelled that right. What am I doing? Yeah, okay. So, Anne, A-C-A. So, a 60-year-old man. Okay, well, you know, we can work it out from his name and DOB. Came to my surgery with a swollen left large toe. Why is this in the introduction? So, right, first of all, I think is better in the introduction, you know, make it clear what you want, right? Like in the previous example, I'm writing to request because you want to ask them to do something, to request your further investigations or investigation of, etc. That's good. Okay. Thank you for seeing Mr. Seymour for what? You want me to see him for what? For what reason? Oh, he's retired and he's got no kids. Well, okay, that's very nice, but why am I reading this first? Shouldn't I be reading what you want me to do at first? I think so. Okay, so non-smoke. Right, now, when you are introducing this stuff, I always think it's good to have an expression like regarding his medical and social history, etc. So, you know, it's clear what this paragraph is doing in my letter, yeah? It's a cliche, but you can use it. It just tells the reader what they're reading. Okay. Okay, non-smoker. Well, if he doesn't smoke, why tell me? He drinks, is suffering, so present continuous. But we've got since 2010, so present perfect continuous would be better because he's still suffering. He has been suffering from. First information 2010. Don't know if that's supposed to be for which he took Conciseness. So I said, what's this got to do with anything? His father died at the age of 75 and he had arthritis. Okay, but you know, if you're going to include a sentence, you have to show it's got a relevance to the rest of the paragraph. I'm not really sure what this is about or what that's doing there. Okay, so we don't really need that there. We don't really need that there. Initially, he visited. So, what most of the people recommend is that you put the name first and then pronouns afterwards. So, initially, Mr Seymour he visited 2014 with complaints of a 4-week history of gout, which is the third bout in 8 months. For that, he was taking he modified his diet. So, why we've got this very short sentence? Again, very short sentence, right? These very short sentences, they're no good, right? We need to put them into, make them a subordinate clause, add it to the previous sentence, okay? But we don't want these very short sentences. That's not very good in terms of a flow. So, okay, so no. So you want to connect these. Also, he modified his diet to decrease. Yeah, I'm not really sure what that is, so I can't make a comment, but I would be tempted to put it into the previous one. Examination revealed what? An examination, his examination, the examination. We don't want note form. We want complete sentences because it's an English test. Yeah. His examination revealed, and why is there a comma there? Revealed that. So let's return. My friend, that was very painful. For this, he was prescribed dietary advice and an X-ray for the left foot, or a left foot X-ray blood test and urine test were ordered. So we don't want these two short sentences. We want something that introduces the sentence to connect it to the rest of the paragraph. It's meant to be a letter, a narrative. You're telling a story. Okay, so but today he came with his reports. What, he had reports? So he brought them to you? I don't think he did. Today he came. So you got his reports and he came at the same time. So this reads that he came and he brought his reports, which I don't think he did. Taking reports, among which the X-ray. Now we need a definite article here because we introduced the X-ray before. So we needed, so, you know, when you introduce something for the first time, you use an indefinite article, an X-ray. For the subsequent use, we need a definite article because we now know which X-ray you are referring to, okay? The X-ray shows minor changes of the left metatarsophalangeal joint, and blood tests shows, or the blood test shows, because you've mentioned it first, you know. Set with nothing significant. Oh, why? What is this? This very short sentence. That doesn't fit really. Except but nothing significant except what? You mean nothing else was found? So I'm not so clear as to what that means. So I'll just leave it there. There was advice to continue, but insisted on the referral to a rheumatologist. I'm referring to you down to gout. Highly appreciated. Again, why would it be highly appreciated? Is he doing you a personal favour? Is he lending you money? Is he letting you sleep in his apartment for a week? Why is it he's not doing you a favour? Why is it highly appreciated? If you could assess the patient and ensure him, and now I'm not sure if he means assure him, because ensure means make sure that something's done. Assure means to give reassurance, you know, oh, you'll be fine, etc. So I'm not sure if he's ensure that he is treated, or assure or reassure him. Not quite certain what he's trying to say there. Okay. So you can see there's a few things here. You know, we don't really need that, or we don't need it there. We don't really need this, or we don't need it there. There's a couple of things, some short sentences that need to be joined up. Pronoun or an article in front of a noun, we need something there. Indefinite article, yeah. So a few things there for attention. Okie doke. So I'm going to save these now. Now, anybody got any questions about these before we move on to the next letters? Anybody got any questions? I'm just going to save these files. And put them in easy class. Very good. Okay. Anybody got any questions for me? I'll wait for a minute or two, see if anybody's got anything they want to ask me. No? Okay, right then. Well, if nobody's got any questions, we'll get on to the next set of letters then. So this is Mrs Clarke. Okay. So let me just sort this out. Okay. So I'm going to save the changes here and post them in easy class. So what's the task? What are we doing here? I can't see. Okay. This is not, without having a task, it's kind of hard to know what we're supposed to be doing. Can anybody tell me what the task is? What are we supposed to be doing here? Anybody tell me what the task is? What are we doing? There's a plan, but there's no task. Anybody got the rest of these case notes? They can tell me what we're doing. No? Okay, well, let's have a look at this one. Mustafa, Dr. Mustafa, is he here? No? Okay. I'm waiting to refer Mrs Clarke and sound symptoms for further assessment, investigation, possibly a bronchoscopy and biopsy. Okay. That breaks it up. I would be tempted to put it, you know, refer, I'm writing to request your assessment and investigation of. I would have cut that down a little bit. I mean, so we know what you've referred her for, you know, further assessment and investigation. It's just a bit of a long-winded way of doing so. You could have simply said, I'm writing to request your further assessment of Mrs Clarke because blah, 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 blah. Okay, well, anyway, there's nothing intrinsically wrong there. 54 office clerk. Okay, been smoking for over 50 years. It's history of lung conditions, as she has no history of allergy. Well, this is obviously important. Not so much so, but I'm willing to let it go because it's got some important information here. So, which is quite, I mean, that's better than having it in the introduction. That's better than having it in the introduction. Yeah. So, okay, I'll let that go. Which is quite presented to my practice with a sore throat, fever and cough, and I was prescribed on next visit. On the next visit, she reported 7 cases with a dry cough, not on shots of a session of chest heaviness. Well, you could say that, or heavy chest. Although she has a good exercise tolerance test, she can walk up 2 sets of stairs or flights of stairs. We usually call it a flight of stairs. The examination was unremarkable apart from right mid-zone wheezes, which were due to the test. And this normal as well. That doesn't need to be capital. Investigations and establishing a die. Well, right. Now, you're not really establishing a diagnosis. You have a provisional one. So you could say something like a definitive diagnosis. You could maybe say that because we already have a provisional diagnosis. So maybe a definitive one. Now, Mary's just typed something here for the task. Follow-up investigations and assessment for thoracic surgeons, for follow-up investigations, bronchoscopy, biopsy. Okay, that sounds good. You usually repeat, what you want them to do at the closing as well. So I would probably, Mrs Clarke for further investigations, possibility blah blah, and establishing definitive diagnosis. So that actually is not too bad. That's not bad at all. The grammar's good. There's no obvious. There's only one missing article there. The grammar's quite good. The lineup's good. I mean, you could probably put something like, regarding her medical history, something, some introductory phrase. You can maybe put something there, but that's not bad at all. Very good. Right, who's this next one? That Isa. I don't know. Is she here? No? Okay. So I'm writing to request assessment and further investigations of Mrs Clarke. Carcinoma. Okay. So this is better than simply I'm writing to refer. You are asking them to do some things. So anyway, that introduction is good. Have we got any social medical history? Now, right, now, personally, I would have put this after the introduction in paragraph 2, because it does set the scene, as it were, for the rest of the story. Would you agree or disagree that this should be in paragraph 2? For this particular letter, because the medical history, well, the social history, she's been smoking, blah, blah, blah. I think that should be right at the start, because it does set the scene for, you know, the rest of the letter. So I would have been tempted, like in the previous one, yeah, put that paragraph 2. And then you can go into the chronology. She first came and she had this and she had this and she had this and that. So everything's clear now. It makes sense. Now, people keep on asking me, you know, and asking in the group, what should we put in paragraph 2? Some courses say it should be the medical and social history. Other cases say it should be the main medical issue, etc. There seems to be some confusion. Well, there isn't. The reason why some people are confused is they're trying to find a one-size-fits-all template that they can use for every letter. And one, you cannot, and two, you shouldn't, because OET vary these letters on purpose because they know that people try and find the easy option. They try and find a template with the same order and the same, and they just change a couple words and that's a B. Well, that's not how it works. Every letter is different. Every letter. Yeah. So for some, like the one that we saw a moment or two ago, the medical history didn't need to be paragraph 2. For this particular one, yeah, I would be, if I were to write this, I would put it in paragraph 2. And then a chronology of the visits. First visit, then second, blah, 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 blah. So, not bad. Let's have a look. So, presents with fever, cough, sore foot and body aches, which she was prescribed penicillin. It's kind of short. I think the first one, all right. 7-week history. How many times does she visit? So she came to sore throat. She's come twice. Right. Okay, that's okay. It's kind of short, but okay. Mrs Clarke with contaminated history of dry cough. Examination revealed her examination. The examination revealed some consultation. With no remarkable findings. Don't need that comma. Mrs Clarke's make it a possessive medical and social history. She's not on any regular medication on allergies, significant family history. Yeah, but mind-related lung disease, you know, that's nothing to do with anything else. You get that specifically breathing in coal dust. So, well, anyway, you can include it if you wish. Now, and then in addition, now I would be tempted now and by the way, she's been smoking for over 30 years. Just as a matter of interest, I thought I might mention this. I would have put this a little farther up in the history. A little bit farther up because, you know, possibly this could be quite important. Okay? So, you know, in addition, you know, she's been smoking for 30 years. Maybe that should be a little farther up. Okay. Anyway, in view of the above, my provisional diagnosis, would you please carry out as a phrasal verb, you carry out further investigations on Mrs Clarke. A bronchoscopy, biopsy and assist with establishing a diagnosis, should be capitalized. Okay. So this isn't bad. Again, this isn't bad. It could be a little better in terms of the layout. Maybe, you know, put a social med history, paragraph 2, and this throwaway sentence, which should have been a little bit farther up in your paragraph. But still, the grammar's not too bad. Well, it's quite good, in fact. Okay. Now, Dr. Shakir, is he or she, are they here? Are they here? Can't see them. Okay. Let's have a look at this one then. I'm writing to request a follow-up. What is this? Singular and plural, singular and plural. So, don't need that. Whole of investigation and assessment for Mrs Clarke, 50-year-old Lady Clarke. A Lady Clarke as opposed to a manly Clarke. Don't think we really need that. We can take that out. Signs and symptoms are suggestive of, okay. So apart from that introduction is good. Okay. Now, social and family or medical history, paragraph 2. That's good. Present simple. What verb form should we be using? Can somebody tell me what's wrong with this? Somebody, what's the grammatical mistake? What should this be? Is been smoking? Eh? Is been smoking? Well, that's not even a tense. Is been smoking? No. Can somebody tell me? Present perfect. Very good, Sama. Very good. Present perfect continuous, in fact. Over the past 30 years, because we use it to establish how long the activity. So Mrs Clarke has been smoking over the past 30 years. Please note your strong history. As a father's what is this possessive of? And her father died due to man-related lung cancer. Okay, that's good. 2 months ago with the complaints of, okay. I wouldn't, I don't know. Can you say has been a heavy smoker? Well, yeah, but I mean, you know the amount, so you can include it, 30 to 35. Yeah, you could say she's been a smoker for over 30 years. That would be fine. Okay, so resolve augmented. Today, Mr Clarke is a 7 weeks history. Don't need that S. 7 week history of dry non-productive cough, heaviness in the chest and shortness of breath, especially at night. Examination revealed her pronoun article. Examination is a noun. We need something in front of a noun. You only use nouns to begin a sentence, which is nominalization. You only do that in short forms of writing, such as a memorandum or a resume. For a letter, to make complete sentences, we don't use a nominalization. So don't begin a sentence with a noun, right? A pronoun or an article or something. Okay, consolidation associated with these. Now, we's is singular, so you can put a singular indefinite article there. However, medical vital sayings are normal. Okay. Gestation, will be more by prison diagnosis, stage consultation. That would be good if you could do for investigation in a condition. Please note she was counselled for possible die. I think it's 2 hours in counselled. Yeah. Oh no, that's not bad. Not bad. So, one thing I would say, you don't need that article there because it's singular and plural. All right. Make that present perfect continuous. We didn't need that a possessive, and make that singular because you've got a singular indefinite article in front of it, and article, pronoun. Okay, apart from that, that's not bad. Right, Dr. Salam, is he here? So, is he here? Oh yeah, I can see him. Osama, is this yours? Yeah? Is this yours? Yeah? Okay. So, thank you for seeing Mrs Clarke, Office Clarke, whose symptoms are suggested. Thank you. Okay, right. Well, as I say, we don't really need that. We could leave it out. Seeing Mrs Clarke for what? Okay, well, again, I'll be tempted, like in the previous examples, to like say what it is you want the person to do. You're writing to request. You want them to do something. I'm writing to request. Okay. Writing to refer for assessment and investigation. So I'd be tempted to put that in your introduction. Okay, so I would be grateful for assessment. Well, okay, I'm sure that you would, but surely Mrs Clarke would be even more grateful. So he's not doing you a favor, really. So you don't really need all this politeness, you know. You can be polite, but you don't have to be, you know, so polite. So, okay, regarding a family history, now we seem to have a couple of different things in a paragraph here. Now, as you should know, every paragraph should group the same information. It should be about one thing and one thing only. Okay, so we've got, this looks like social history. What does this? And she stays with us. Right. So, right. Mrs Clarke is no. So this is important, yeah. And this is relevant because why? Okay. Then you've got the first visit, and then you go back to family history, but you don't mention the father. So right. Hang on. Let me turn this off. Don't change it. So we don't need. So this needs to be separate. Right. This needs to be separate. Otherwise, it's confusing the reader. So put that there. Okay. Right. Put that there. So we put this here at the start regarding her family history. Okay. Mrs Clarke has been a heavy smoker for 30 years. Okay. She stays with husband and son. She has a popular family history of Aboriginal Casanova, went to mother, and her father, blah, 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 died of long-related mining stuff. Okay, so that is better. Regroup, get the information. Don't put different things in a paragraph. Every paragraph should be about one thing and one thing only. So, short. She had, okay, what symptoms did she have exactly? How did you treat her? If we look at the previous examples, which are quite good, everybody else, you know, so she had a cough, we gave her augmentin. What did she do? She had a fever, cough and sore throat. She was prescribed, yeah. So this sentence is a little bit short. I would put a bit more detail information in that. It's kind of short. On today's visit, Mrs Clarke in the clinic complaining of a 7-week dry cough with chest accident and a feet like breathlessness, a feeling and a feeling of breathlessness. We can't have breathlessness feeling. However, she didn't report either fever or rigors and confirmed on her ability. Well, you don't confirm on. She confirmed her ability to do her daily activities. Okay, clinical examination was remarkable. Over chest X-ray, a CT scan showed low intensity of writing out. Was given a provisional diagnosis. You could use a passive, but you know, you don't actually need it. I diagnosed, which is for assessment, to be, oh, this is a long long sentence. In light of the above information, Mrs Clarke was given provisional diagnosis of carcinoma, which needs your further assessment. Okay, you could have ended it there, with bronchoscopic examination for obtaining a tissue biopsy to be confirmed. This is what you call a run on a sentence, where you've got subjects and verbs and you don't know who is doing what. So that sentence needs to be reworked, broken into two, reordered, etc. Your effort would be highly appreciated. By whom? And why would it be highly appreciated? Don't need that sentence. Don't need it. You could say, you know, should there be any queries, please do not hesitate to contact me. Okay, so I say that sentence is a bit long and confusing. That needs a bit of work. That's a bit short. I don't know if we need that. As I said, that paragraph needed reworking. Regroup the information. That's the layout part of a task. You know, you have to fulfill the task. The layout's got to be good. There's got to be a logical flow to the sequencing of information, and then of course grammar and vocabulary. So not too bad. Now, how many letters have we got? Oh, one more. Okay, I'll finish this. That will do me, then I'll be off. I've got other things to take care of today. Dr. Omer, is he or she here? Is he here? Is that? No, there's an Omar here, but this is Omer. Now, I don't know if that's the same person. Is this yours, Omar? Is this one yours? No, is it a different doctor? This is yours, yeah? Oh, right, oh, Tasneem, right. Well, you keep using all these different names, right? So there's Omer here, there's Omar there, there's Tasneem here. People keep using different names and different spellings. It's no wonder I don't know whose is whose. Anyway, let's have a look at yours then. Writing to refer Mrs Clarke. Well, if you were to include that, we would need an article, A54 Office Clarke, which presenting science because I feel like assessment further investigations. Okay, well, that's not too bad. Again, I'd be tempted to make a request. We don't really need that. You can include it, but we can work it out from a date of birth. Though you didn't put the date of birth there, so I suppose that's okay. I would always be tempted to put the DOB though, So not too bad. Now, social medical history. Paragraph 2, good. Mrs Clarke is living with her husband, a husband, someone else's husband. Whose husband is she living with? This needs to be clear, right? And I don't know why we need that. Is that pertinent to the investigation? Maybe not. Now, okay, that is mother and father, okay. So apart from that, the rest of it's good. That's what we need. So initially, now we need to break this up. Okay, so visit 1, separate a paragraph, visit 2, separate paragraph, visit 3, etc. Initially, Mrs Clarke presented with few symptoms and dry cough and a dry cough, which were completely released, I don't know, released, I wouldn't use that verb. Were completely eased. I mean, you could say like, were completely eased or completely cured or, but not released. That means to set free, So that verb, I would choose a different verb. Okay. 6 weeks later, she turned up at my clinic, so my history of martial at the birth at night, having a chest. However, the PT, what is that? Her daily activities. So every paragraph, I would be tempted to do the name first, then you can use pronouns afterwards. Okay. So the PT is that's the patient or her daily activities. Access tones were not affected. The essential micropersonal condition, consolidation. Okay. Given that information, my diagnosis is bronchitic carcinoma, which I'm referring to, for which I am referring her to you, for which I am referring to her. So, right, you are referring her to you. Requesting a evaluation of C. Please note, I have counsel. This is client condition. Should the equation not hesitate to contact me. Okay, okay. So that's not too bad. Not too bad. Yeah, not too bad. I would maybe think of a different verb there. I don't know if we really need that there. We need an article. We need a pronoun there. And the order was wrong there. Her to you, not referring to you, her. So I think that's it. I think we've got through all of them now. So I'm going to be, I'll take some questions for a moment if anybody has any. I'm just going to save these files now. Let me just save these and I'll put them in Easy Class. You can access these in a minute. Mrs Clarke, comments. And I'll save the video recording for later. I notice that people are not attending. I think they're not attending because they hope they can watch a video recording at a later date. So maybe I'll hold the video back for a day or two and get people to come. So does anybody have any questions or any comments about anything before I go? So I'm going to put these in Easy Class. And you can look at these. I can turn your microphone on if anybody wants to say anything. I can turn it on or not. Well, doesn't seem like anybody's got any questions then, so I'll stop this recording. I'll put the files in Easy Class. I'll be on a Telegram for a while. So if you've got any questions or comments there, I'll put this video, I'll make this video available a little bit later on. Okay, so I'll see you later.